that day I have told you that testis, microscopic structure of testis is important, okay, for your upcoming exam. I hope you have prepared. If not, please prepare it along with the diagram. Okay. Now, can anyone tell me what are the coverings of the testis? Now, what is no. Always keep that in mind whenever you are talking about the coverings. It should be from inside to out or outside to in. So, what is the outermost layer? Tunica vaginalis. After that, albuginea and then tunica vasculosa. Okay, these are the three coverings of the testis. Okay. Now, in case of microscopic structure, knowing these coverings are important. If you remember, I have shown you. Yeah, I hope you remember. I have shown you this diagram that day. Okay. So this is the sagittal section of the testis. Okay, this is the sagittal section of the testis. This diagram is very important. Why it is important? First of all, you can see all the layers of the testis. Okay, can you see the tunica vaginalis? See, so tunica vaginalis is having two layers, one parietal layer, one visceral layer. Okay, and that is completely related to the descent of the testis, which you have studied. Okay, it is related to the processus vaginalis. If not, see, you have to correlate things, or else you will not understand. I know you have studied the descent of the testis. So the descent of the testis is responsible for getting these two layers. Okay. So in tunica vaginalis we are having two layers. Outer one is the parietal, inner one is the visceral layer. After that, tunica albuginea, thick or you can say dense fibrous layer, tunica albuginea, and tunica vasculosa is the inner vascular layer. Okay, where blood vessels are present. Okay, these three layers should be known to you. Next, what we have to study? Next, we have to study is the microscopic structure. Now, in order to study the microscopic structure, first, you have, as I said, you have to know about the coverings. Next, once you have understood about the coverings, then you have to know the internal structure. For that internal structure, I have shown you this diagram. In this diagram, you can see the internal structure of the testis. Okay. Now, what is present exactly in the internal structure of the testis, that is shown in this particular diagram. So, first you have to focus on the mediastinum testis. This particular area is called the mediastinum testis. From mediastinum testis, you can see the incomplete septa extending into the substance of the testis and dividing it into small lobules. You can see these are the lobules. Okay. So, you have to take one particular lobule. These are conical in shape. Inside the lobule, what is present? Seminiferous tubules, highly coiled seminiferous tubule. 2 to 3 highly coiled seminiferous tubules are present. So, can you see the tubules? So, from this mediastinum testis, I hope you can see the vertical, this incomplete septa, which are going into the substance of the testis and divided into numerous lobules. As you can see, this is one lobule, this is one lobule, this is one lobule, like this numerous lobules are there. Okay? These are conical in shape. Apex is directed towards the mediastinum testis. Next, if you take one particular lobule, suppose you have taken one particular lobule, inside that what is present? Highly coiled seminiferous tubules are present, as you can see in the diagram. Okay? At least 2 to 3 highly coiled seminiferous tubules are present. Now, up to that much you can see. Now, as I said, it is highly coiled. Now, if you take one seminiferous tubule and if you stretch it, as I said, it is highly coiled. So, the length becomes approximately 60 centimeter. Just imagine. Small testis, inside that it is highly coiled. If you stretch it, the length will become approximately 60 centimeter. Diameter is very less, 1 or 2 micrometer. Okay. Now, that much can be seen in normal eye. Beyond that, if you want to see, what you need? We need microscopic structure. So that means, suppose you are taking a section over here, preparing the slide, then what you can expect, what you can see? First of all, you can see the coverings. Okay, and along with that, you can see the cut section of the lobules. And inside that cut section of the lobules, what you can see? क्या दिखाई देगा? Lobules के अंदर क्या है? Seminiferous tubule. Now again you are taking the section of the seminiferous tubule. उसके अंदर क्या होगा? What will be inside the seminiferous tubules? Only two types of cells are there inside the seminiferous tubule. What are they? Yes, Sertoli cells and spermatogonia or spermatogonic cells. That means different layers of development of sperms are there. Okay, spermatic cells will be present. Okay, that can be seen inside the seminiferous tubule. Okay, so like this you have to proceed in order to write about the microscopic structure. Okay, तो एग्जाम में देखो क्वेश्चन क्या आता है. फॉर एग्जाम्पल अगर मान लो एग्जाम में क्वेश्चन आया फॉर 5 मार्क्स का कि डिस्क्राइब अबाउट द इंटरनल स्ट्रक्चर ऑफ टेस्टिस. Describe about the internal structure of testis. At that time what you have to do, you have to draw this diagram and then you have to describe. In description what you have to write, first of all you have to write about the coverings, layer, what are the layers present, and then you have to mention up to the seminiferous tubules. Okay, that is about the internal structure. If it comes for microscopic structure, then what you have to do, you have to write all those things in brief, but you have to focus more on the microscopic structure of seminiferous tubule. Okay, because in order to see the microscopic structure of testis, what you have to study, you have to study the microscopic structure of seminiferous tubule, because inside that only all those cells are present. I hope it is clear. तो अगर मान लो internal structure आया, this diagram is more than enough. Beyond that you don't have to draw any diagram, just the explanation part. Okay, but in case of microscopic structure, it depends on you. If you are having time you can draw the diagram, if not, draw the microscopic structure. Okay, now in case of structure of testis, okay, so first of all, as I said, thick fibrous membrane is present, that is called as tunica albuginea, which covers the entire testis. Okay, and from there it goes into the posterior border. Okay, as a form of incomplete partition known as mediastinum testis. That means whenever the tunica albuginea, not tunica vaginalis, the middle layer, when it is covering the testis, please keep that in mind, the posterior border is not covered. Posterior border is kept empty. Why? Because the blood vessels, nerves has to enter the testis through posterior border. ठीक है, तो in that from that particular part it is going inside the testis as a form of vertical septum, that is called as mediastinum testis. Okay, from this anterior part of the mediastinum testis, numerous septa will radiate and divide the substance of the testis into various lobules, which we have seen just now. ठीक है, next what will happen, each lobule if you take is roughly conical shape, apex is directed towards the mediastinum testis. ठीक है, next the glandular part of the testis, approximately 200 to 300 lobules are present, and if you take one particular lobule, inside that we are getting 2 to 3 seminiferous tubules which are highly coiled. Each tubule is highly coiled. When stretched, the length is approximately 60 centimeter and diameter is approximately 0.2 millimeter. Okay, next the seminiferous tubule joined together at the apices. Now this part is also important. So up to seminiferous tubules you have followed. Now at the apical part of the lobule, the seminiferous tubules will join together, okay, to form straight tubules, and then it will enter the mediastinum of the testis. Okay, next what will happen, they will anastomose with each other to form a network of tubules. These are called as retitestis. Okay, from retitestis we are getting 12 to 30 efferent ductules. Now those efferent ductules will emerge at the upper pole of the testis and then they will enter the epididymis. Okay, next what happens in the epididymis, each tubule becomes highly coiled to form lobe of the head of the epididymis. That means those 12 to 30 efferent ductules, okay, from the upper pole of the testis, they will merge from the upper pole of the testis, or they will come out from the upper pole of the testis, okay, and they together will form the head of the epididymis. After that, those 12 to 30 ductules, they will converge to form one highly coiled singular duct. That is the duct of the epididymis, and that particular duct of the epididymis is forming the body and tail of the epididymis. And after that, the tail of the epididymis is continuing as vas deferens. Okay. So here you can see the tubules end in a single duct which is coiled itself to form the body and the tail of the epidermis, and it continues with the ductus deferens. Okay. Now in this diagram, can you see the mediastinum testis? So here this is the mediastinum testis. So these coverings, whatever they are present, it is absent in case of mediastinum, in case of this posterior border, because through this posterior border only blood vessel nerves they have to enter the testis. Okay. Now from the mediastinum testis, see this is the mediastinum testis. So you see these are the lobules. Inside the lobules you can see highly coiled seminiferous tubules are there. Okay. So at the apical part, this highly coiled seminiferous tubule becomes straight, okay, and then they will go into the mediastinum testis. Once they reaches the mediastinum testis, after that what will happen? They will anastomose with each other to form a network-like structure. It is called as rete testis. From rete testis, you can see we are getting straight ducts, okay, which are going out of the testis. That's why they are called as efferent, not afferent, efferent ductules. Okay, so see, these are efferent ductules, numerous, approximately 30. Now those efferent ductules, where they will go from the upper pole of the testis, they are going towards the epididymis. Okay, so this particular efferent ductules, it will reach the head of the epididymis, as you can see. After that, what will happen? These efferent ductules, they will form a single highly coiled tube. Single highly coiled tube. And that highly coiled tube, when it is going downwards, it will form the body and the tail of the epididymis. And after that, it continues as vas deferens, which you can see in the diagram. Okay. So that is expected from you whenever you are writing about the internal structure of testis. Up to that much is the internal structure of a testis. In order to understand the microscopic structure, you need this, or else you will not understand the microscopic structure. Okay. Next, whatever we will study, that will be the microscopic structure. Beyond that. Now, in case of microscopic structure of the testis, what is present? First of all, the layers will be there. Okay. Here, देखो, 3 layers will be there. First of all, there will be tunica albuginea, tunica vasculosa. So here I am excluding the tunica vaginalis because that is the outermost layer. Okay. So I am excluding this. Beyond that, we are getting tunica albuginea because this is very important, which is forming the mediastinum testis. And tunica vasculosa, those lobules, whatever you have seen inside the lobules, blood vessels are also present. Okay, and that is forming the tunica vasculosa. Next, as I said, the seminiferous tubules are there. Now, if you see the seminiferous tubule, what is present inside the seminiferous tubule? Mainly 2 types of cells are there. As you can see, spermatogonic cells, where spermatogonia, spermatocytes, means different stages of spermatogonic cells are present. Along with that, another important type of cells are that those are called as Sertoli cells, okay, which provides nourishment to the different stages of spermatogonic cells. Okay. Along with that, another important function is there. Very important function of these Sertoli cells. What is this function? They are forming, yes, no. They are forming, no, they are forming blood testis barrier. Okay, they are forming blood testis barrier. These Sertoli cells, okay, they are forming blood testis barrier. तो MCQ में आता है, which cells are forming the blood testis barrier in case of testis. ठीक है. So first of all, these Sertoli cells, what are the functions? Supporting cells. Along with that, they removes the residual body. Along with that, another important function is there of the Sertoli cells. What are those? What is that important function? They form blood testis barrier. Okay. Now, can anyone tell me what is the significance of that blood testis barrier? What is the significance of that blood testis barrier? See, the spermatogonic cells which are present inside the seminiferous tubule, different stages of spermatogonic cells are there. Okay. Now, those cells are not exposed to the bloodstream. Okay. Never these cells will be exposed to the bloodstream. So if they are not exposed to the bloodstream, if they are not exposed to the blood, then what will happen? The blood will treat it as antigen. Okay, the blood will treat it as antigen. So if it is getting exposed, the blood will produce antibodies against them. As a result, those spermatogonic cells will get destroyed. Okay, so in that case, the blood testis barrier, which is for, okay, they will keep the spermatogonic cells, okay, away from the blood, so that antibodies cannot be produced against it, and that is the important significance of the blood testis barrier. Okay. Next, another important type of cells are present. Now, what are these cells? These are the interstitial cells of Leydig. Now, here you have to understand one thing in the microscopic structure. ये जो seminiferous tubule है, inside the seminiferous tubule we are getting these two types of cells only. तो ठीक है. Next, another types of cells are there. These are called as interstitial cells or cells of Leydig, or also called as Leydig cells. Interstitial cells means they are present in between the cut section of the seminiferous tubules. Okay, so many seminiferous tubules are there. Okay, in between the seminiferous tubule, the interstitial space which is present, in that particular space along with the connective tissue, these interstitial cells are present. Okay, as you can see, lie in the clusters between the seminiferous tubule, not inside the seminiferous tubule. Okay, so whenever you are writing, please mention that where these interstitial cells of Leydig are present. Can anyone tell me what is the function of these cells? Yes, very good. They produce male androgens. Next, here you can see straight tubules are there and retitestis. So the lining epithelium is different. In case of straight tubules, we are getting Sertoli cells only. Next, in case of retitestis, it is lined by simple cuboidal to columnar epithelium. Okay. Now, inside the seminiferous tubule, mainly two types of cells are there, also called as complex stratified epithelium. Now, here the meaning of stratified means not that transitional epithelium or stratified squamous, stratified keratinous, ऐसा नहीं है. Here stratified means though two different types of cells are present. Okay, that's why it is mentioned as complex stratified epithelium. Okay, now what are the different types of cells present? Because when you will focus the microscope in a particular seminiferous tubule, cut section of seminiferous tubule, at that time you will be able to see multiple layers of cell. It doesn't mean that it is stratified layer. इसका मतलब क्या है? Different types of cells are present. Mostly which type of cell? First of all, you will be getting Sertoli cells and then spermatogonic cells. So you may get primary spermatocytes, secondary spermatocytes, spermatid, spermatozoa, like this. Different stages of spermatogonic cells will be there. That's why it appears as multiple layers. Okay. Next, its seminiferous tubule. So already I have told you length is approximately 50 to 60 centimeter, and micro diameter, if you see, 150 to 200 micrometer in diameter. Next, Sertoli cells are very important. They are supporting cells and having columnar or pyramidal in shape, with light stained euchromatic nucleus. So the nucleus is staining lightly in case of these Sertoli cells. Sertoli cell, one Sertoli cell, another Sertoli cell, okay, with the help of the junctional complex, they form blood testis barrier. Now that isolates haploid germ cells from immune system, okay, and that is called as secluded antigen. Okay, that means it is hidden from the bloodstream, or you can say this is hidden from the immune system, or else the antibody will be produced and the spermatogonic cells will be destroyed. Okay. Next, another important function is Sertoli cells have follicle stimulating hormone or FSH receptor on their surface. Okay, that means they get stimulated with the help of FSH. Now this FSH, what it will do, it will activate the Sertoli cells as a result of secretion of anti-Mullerian hormone. तो जो FSH receptors है, okay, FSH receptor क्यों रहता है? So that the FSH which is secreted, it will go and bind to the Sertoli cell. After that, what will happen? There will be secretion of hormone. Which hormone? Anti-Mullerian hormone. Can anyone tell me what is the function of this anti-Mullerian hormone? That day I have mentioned in the class. Have you heard about Mullerian duct? I know you have heard about Mullerian duct. You have studied the female reproductive system. Most of the female reproductive system is derived from Mullerian ducts only. ठीक है, तो this Mullerian duct is present in case of male also, but because of the secretion of anti-Mullerian hormone, that particular Mullerian duct used to get regressed, okay, or degeneration takes place. That's why no structure can be formed from this particular Mullerian duct. Okay, so that is also important function, and that takes place during intrauterine life. Okay, so here you can see secretion of androgen binding protein. Okay, then secretion of inhibin that inhibits the FSH release of from the adenohypophysis, supports and nourishes the germ cell, and phagocytosis of residual bodies of the spermatogenesis. So these are some important functions of the Sertoli cell. Now here it is a beautiful diagram, okay, schematic diagram, drawable diagram of the Sertoli cells. Along with that, you can also see the different stages of spermatogonic cell. Can anyone identify where are the Sertoli cells? Can you identify where are the Sertoli cells? The large one. Okay. For example, ये देखो, this is one Sertoli cell. 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 ठीक है. In between the Sertoli cell, can you see the junctional complex? ये देखो, this is the junctional complex. So this is forming the blood testis barrier. ठीक है. Now if you go into further details, okay, उतना details नहीं चाहिए. If you go to the further details, then you can notice one thing. When the junctional complexes are formed between the Sertoli cells, ठीक है, it is dividing the lumen of the seminiferous tubule into two compartments or two parts. See, adluminal compartment and the basal compartment. ठीक है. So the cells which are present in those two compartments are different. जो immature cells है वो नीचे रहता है, as you can see. These immature cells, these are the spermatogonic cells, spermatogonia, these are present over here. Once they become mature, they will go to the adluminal compartment. ठीक है? As you can see, these are the different types of spermatogonic cells which are present over there. Okay? For example, primary spermatocytes, secondary spermatocytes, spermatids, they are present over here. So this particular diagram will help you to understand about the internal structure of seminiferous tubule. ठीक है? Particular seminiferous tubule. Inside that, what is present? Okay. Then how the blood testis barrier is formed. Where are the different stages of spermatogonic cells are present. Okay. So I'll request everyone to draw this particular diagram. Okay, in your practical notebook. Okay, next the most important part about the spermatogonic cells are, you have to know the location of the different spermatogonic cells. Okay, so first of all, the spermatogenic cells, they derive from primordial germ cells. Already you have studied about that. They will replicate to form various stages of spermatogenesis, and which can be seen in the slide. Okay, next how they are arranged. As I said, they will appear in the form of stratified manner, because different cells are there, arrangement will be different. That's why they will appear as stratified layer. Okay, how they will be arranged? First of all, as you can see, from the basal lamina to the luminal area, that means from the basal part of the lumen to the middle of the lumen, how they will be arranged. So they are arranged in the form of spermatogonia. Okay, so how they will be arranged? From the basal part of the lumen to the middle part of the lumen. First is spermatogonia, then spermatocytes, then spermatids, and then spermatozoa. This is the arrangement. Okay? So in histology, this thing should be mentioned. Okay? Why I am telling you this? Because based on this only you have to identify. Under low magnification it cannot be identified, just you can see the spermatogenic cells, but under high magnification it can be identified. Now in order to identify that, you should know how the cells are arranged. सबसे नीचे कौन सा सेल रहता है, इसके ऊपर कौन सा सेल, इसके ऊपर कौन सा सेल. ठीक है, तो सबसे नीचे कौन सा सेल रहेगा? स्पर्मेटोगोनिया, एकदम बेजल पार्ट में रहेगा. इसके बाद कौन सा रहेगा? स्पर्मेटोसाइट्स. इसके बाद स्पर्मेटिड्स, सबसे ऊपर रहेगा स्पर्मेटोजोआ. दिस इज हाउ द सेल्स आर अरेंज्ड. ओके, तो हियर यू कैन सी मल्टीपल सेल्स आर देयर, दैट्स व्हाई इट अपीयर्स एज स्ट्रेटिफाइड लेयर. Okay, next the lamina propria of the or you can say the connective tissue layer of the seminiferous tubule. What is the meaning of this? Now this doesn't mean that the connective tissue which is present inside connective tissue nahi rehta hai. It is present outside the seminiferous tubule. Okay, So you can see it is a thin layer of vascular connective tissue surrounds the each seminiferous tubule. Okay. So each and every seminiferous tubule, it will be surrounded by a vascular layer of connective tissue, that is the lamina propria. Okay. Here fibroblasts are not present. Few contractile cells are there, this which are called as contractile myoid cell or peritubular cells. तो इसका जो contraction होगा, it will help in transportation of the spermatozoa. Next, the Leydig cells are there. So already I have told you the Leydig cells or interstitial cells in between the cut section of the seminiferous tubules. Okay, inside the lamina propria. Okay, you are getting the interstitial cells of Leydig. So what is the important feature? These cells are large polygonal eosinophilic cells with a round nucleus. That also nucleus present centrally. This is the appearance of the cell. And single cell nahi rehta hai, clusters of cells will be there. Okay, the interstitial cells of the Leydig, if you see, clusters of cells will be present, not a single cell. And as you know, they are having LH hormone receptors, and the most important function is they produce testosterone. So here you can see this is the low power microscopic structure of testis. Okay. The microscopic structure of testis, that also low power. What you can see over here? Can you see the covering? ये कौन सा covering है? Tunica albuginea. Okay. I hope you can see it is very dense, fibrous layer. ठीक है. Beyond that, what you can see over here? So what are this? What are this? Already I have shown and I have shown the diagram. In case of microscopic structure, which diagram you have to just now I was showing, that diagram should be drawn for microscopic structure, and for internal structure the previous diagram which was written as sagittal section of the testis. Okay, so here in the microscopic structure what you can see, first of all you can see this tunica albuginea. Okay, this particular layer tunica albuginea. Beyond that what you can see, so what are this? These are the cut section of seminiferous tubules. Okay, these are the cut section of seminiferous tubule. Now inside the seminiferous tubule, focus on one seminiferous tubule. Okay, suppose you have taken one particular seminiferous tubule. Inside this, can you see the cells? ये देखो यहाँ पे, can you see the cells? Now you can see these cells how they are arranged in the form of multiple layers. Okay, so under low power it is very difficult to identify which is the Sertoli cell and which are the spermatogonic cells. For that high power magnification is required. Okay, that I will show you under high power. Next, suppose this is one seminiferous tubule, this is another seminiferous tubule. In between this, I hope you can see some connective tissue are present. Okay, so in that particular connective tissue only the vasculosa will be present, tunica vasculosa or the vascular coat where the blood vessels are present. Okay. Next, you can see the so here you can see it clearly. To see this is one cut section of the seminiferous tubule. Okay. Now here also you can see a cut section of the seminiferous tubule. In between these two cut sections of seminiferous tubule, if you concentrate over here, this is the interstitial space. Okay, where that connective tissue is present, the lamina propria, which I have mentioned just now. In that, I hope you can see this is the interstitial cells of Leydig. Okay, so multiple cells will be there. Okay, large nuclei, centrally placed nucleus can be seen. Next, if you concentrate over here, okay, then what you can see? So can you see the spermatids at the center? And if you see the Sertoli cell at the basal part, then you can see the primary spermatocytes. You can see the spermatogonia. Okay, so what I have mentioned, the arrangement, according to that, you can see the cells present over here. Okay. So this is the microscopic structure of testis under high magnification. So here mostly you have to see a particular seminiferous tubule. Inside that, what are the different types of cells present? Okay, how they are arranged, that you have to see. Next, the interstitial cells of Leydig, and then if the slide is very good, then you can see some blood vessels also. After testis, what is the next part? After testis, what is the next one? Huh? No. After testis, complete testis, what is epididymis? Okay, so here also you can see this is the histology of testis under low magnification and this side is the high magnification. So both the images are shown so that you can compare between the two images. तो यहाँ पे क्या दिखाई दे रहा है? What you can see over here? First, what is this? Tunica albuginea. After that, can you see the tunica vasculosa? ठीक है. Next, what are these? These are the cut sections of the seminiferous tubules. Inside that you can see different cells are present. That means spermatogonic cells and the Sertoli cells. ठीक है. Next, you can see the interstitial cells also, and these are the blood vessels. Okay, next is the epididymis. So if anyone asks you what are the parts of epididymis, just now I have told you the parts of epididymis. It is having head, body and tail, as simple as that. Okay, three parts are there, head, body and tail. Now the most difficult part in case of male reproductive system which I have seen is that identification of epididymis and identification of testis. Now before going to the explanation of the testis, let me show you the slide of the testis. You have slide of the epididymis, you have seen the slide of the testis. ये देखो, this is the slide of epididymis. Appearance is almost same. Okay. See the appearance. Forget about just ignore this particular part. This is the high magnification, this is the low magnification. देखो same दिखाई दे रहा है almost. Okay, so how you have to differentiate? यहाँ पे तो चलो फिर भी it's okay, some differences are there. When you will see under microscope, okay, पूरा same दिखाई देता है. Then the question is how to differentiate. So first I will explain the epididymis, then I will ask you. You yourself have to answer that these are the differences. Now in case of epididymis, as I said, it is a single tube, highly coiled duct. Okay, so a single duct is there, but it is highly coiled. Okay. Next, only two layers are there. First of all, you can see epithelial layer is there. Now in the epithelial lining, what are the different types of cells present? Only one cell is there, that is the pseudostratified columnar epithelium. Okay. Now in case of pseudostratified columnar epithelium, we are having two different types of cells. What are they? Tall cells, these are called as principal cells, and basal cells, which are the short cells. Next, if you see the tall principal cells, in that you are getting the stereocilia, which is nothing but a modified microvilli. Okay, modified microvilli, that is the stereocilia, which is not motile. Next, goblet cells are absent. Next, in the muscular layer, we are getting only one layer of circular smooth muscle cells. Okay, and the thickness, it increases as you will go towards the vas deferens. The circular layer, thickness of the circular layer will increase. Okay, so only that much is present. And obviously this, though lining epithelium is there, so you will be getting the lamina propria also, or the connective tissue layer. Now what is the function of the epididymis? First of all, absorption, phagocytosis of the residual bodies, secretion of the glycoproteins. Now here you can see the epididymis. So see, this is the epididymis. This is the head of the epididymis. Okay, these are the efferent ductules. Okay, then here you can see the body and the tail of the epididymis. And after that, from here the vas deferens starts. Now this is the schematic diagram of the epididymis. Now here what you can see. Now in the beginning, have you noticed I have mentioned that only one tube is present, highly coiled, only one tube. But here cut section of numerous tubes are there. Why? क्या लिखा है यहाँ पे? What is written? Single. So if you take, suppose this is one tube, If you take a cut section, how many cut section will be seen? One. How many cut section you can see? Multiple. Why? Huh? Yes, very good. At least you have followed. Okay. So this was straight. But if it is highly coiled like this, so if you take the section, so one section from here, one section from here, one section from here. So like this multiple cut sections will be there. Okay. That's why the multiple cut sections can be seen. Okay. Next. So what is the lining epithelium? Pseudostratified columnar epithelium. That also two types of cells are there, principal cell and basal cells. So if you see the magnified part, so here you can see first of all principal cells are there which are tall, okay, and you can see the basal cells which are shorter, okay. That's why the position of the nucleus is also different, though it is pseudostratified. Now if you see the principal cells, what they are having stereocilia. ये देखो, can you see the stereocilia? Okay, stereocilia is present in case of principal cells. Basal cell short रहता है, उसमें नहीं रहता है, ठीक है. Next, if you go beyond that, okay, if you go beyond that, here you can see a smooth muscle layer. Okay, only one layer of circular muscle cells are present. Okay, it is important in case of epididymis. Why? Epididymis से क्या होता? What is the function of epididymis? Storage and maturation. Okay, both are taking place. So once it is mature, when it will come out, so this active contraction of the smooth muscle cells are very important. After that only it can reach, the spermatozoa can reach the vas deferens. Okay, now come back to this particular part. So here you can see these are the cut sections. See, these are the cut section. Now here you can see pseudostratified columnar epithelium with stereocilia. Now you have to mention that stereocilia is only present in case of the principal cell. In basal cells, these stereocilia are absent. Okay. Next, you can see the smooth muscle layer. Okay, see this is the smooth muscle layer. Okay, and then here in between the cut sections, we are getting the connective tissue. Okay, so this is about the histology of epididymis. Now this is the previous one was the schematic diagram. This is the original low power image of epididymis, and these are the high power image of epididymis. Okay, where you can see these are the sperm cells which are present. Here you can see the stereocilia also, and this is the pseudostratified columnar epithelium. Okay, and this is the smooth muscle layer. Now, if you see the slide of epididymis and if you see the slide of testis, how you will differentiate? एक एक करके बोलो. First, what you have to mention, what you have to see? Yes, epithelial lining. In case of this one testis inside the seminiferous tubule, no epithelial lining. Instead of that, we are only getting two types of cells. It is stereocilia and spermatogonic cell. ठीक है, इसके अंदर क्या रहता है? Yes, that also two types of cell, principal cell and basal cell. Where in case of principal cell, what we are getting? Stereocilia. ठीक है. Next, another important point. Yes, very good. Smooth muscle layer. ये देखो, ये जो smooth muscle layer है, ये smooth muscle layer in case of testis it is not there, but here it is present. ठीक है. So these are two important differences. Based on that, we can easily identify. And another thing you can say that यहाँ पे Sertoli cells नहीं रहता है. That also you can add. Sertoli cells are not present over here, but in case of testis, it is present. Now, can anyone tell me beyond after that what is the next after epididymis? What? Yes, very good. After epididymis, it will be the vas deferens. So vas deferens is also called as. See, in some book it is written as ductus deferens, some book it is written as vas deferens. Don't get confused. Meaning same. Okay? Now, this vas deferens emerges from the tail of the epididymis. It is a fibromuscular tube, length, see, approximately 45 centimeter. Okay, it conveys spermatozoa from the epididymis to the ejaculatory duct. Okay. Next, the ductus deferens enlarges where before termination it enlarges to form the ampulla. Okay. Now this vas deferens will join with the duct of the seminal vesicle, which is situated on the posterior aspect of the urinary bladder to form the ejaculatory duct. And ejaculatory duct opens into the prostatic part of the male urethra. Now the spermatozoa which is transported along the vas deferens, okay, the muscular contraction of the wall helps in the traveling or helps in the conduction of the spermatozoa. Now here you can see, can you see the testis? After that I hope you can see the epididymis. ये देखो ये epididymis है, ठीक है. Epididymis का कितना part रहता है? How many parts are there? 3 parts. What are they? Head, body and tail. Beyond tail, what you are getting? Vas deferens. So see, this is the vas deferens. Okay, length is approximately 45 centimeter. Beyond the termination, it is forming a dilatation that is called the ampulla. ये देखो, this is the ampulla of the vas deferens. After that, this is the seminal vesicle. This is the duct of the seminal vesicle, which will join together with the ampulla of the vas deferens to form the ejaculatory duct. This is the ejaculatory duct. Okay. Now here you can see ejaculatory duct is joining or is draining into the urethra. Now this is the prostatic urethra. Okay. So what you can expect in case of vas deferens? First of all, lining epithelium will be there. After that, a muscle coat will be there, followed by the adventitia. Okay. तो इन केस ऑफ लाइनिंग इपिथेलियम, फर्स्ट ऑफ ऑल यू शुड नो दैट जो वास डिफरेंस होता है, वास डिफरेंस का जो म्यूकोजल लाइनिंग होता है, और इफ यू से द म्यूकोजा, इट इज हाईली फोल्डेड. इफ यू रिमेंबर द यूरेटर which we have discussed last time. Okay, so the mucosa is highly folded. Now here what you can see, pseudostratified columnar epithelium with stereocilia and lamina propria is also there. Okay, so lining epithelium is almost same. Epididymis का lining epithelium, and in case of vas deferens lining epithelium is almost same. Next you can see smooth muscle coat, but here the difference is present. Previously we have seen only one layer of smooth muscle coat is present, but here you can see 3 layers of smooth muscle coat are there. Inner longitudinal, outer also longitudinal, middle one is thick circular. And if you see the muscle coat, it is very thick in case of vas deferens. Lumen का जो thickness है, if you see the lumen, diameter of the lumen, it is small as compared to the thickness of the muscle layer. Okay, and lastly we are getting adventitia, which is made up of loose areolar tissue. The main function is peristaltic contraction, which helps in ejaculation. Now this is the diagram, histology of vas deferens. Now in the vas deferens, where is the lumen? Can you identify the lumen? कहाँ पे है lumen? So this is the lumen. As I said, you can see the mucosal folds. See, these are the mucosal folds. ठीक है. Next, this is the lining epithelium. ये देखो. This is the lining epithelium, where stereocilia is also present. Beyond that, we are getting the lamina propria. Okay, beyond that, we are getting the lamina propria, and this entire part is made up of smooth muscle cells. Okay, 3 layers are there. You can see this is the inner longitudinal, this is the middle circular, which is the thickest, and then the outer longitudinal, followed by the outermost adventitia, which is made up of loose areolar tissue. Okay, so identification of vas deferens is very easy. Okay, identification of vas deferens is very easy. Why it is easy? Because you will see, if you see the lumen and if you see the muscle thickness, जो muscle का जो thickness है, wall of the thickness of the muscle wall, that is more. Okay, lumen बहुत छोटा होता है. That is the vas deferens. Okay, next is the prostate gland. So what you have studied about the prostate gland? Anyone? Prostate gland is also important. Study the prostate gland properly. ठीक है. So it is the largest accessory sex gland. Okay, dense conical organ extending from the neck of the bladder, which surrounds the beginning of the urethra. ठीक है. Now if you see the prostate gland, mainly it is made up of 30 to 50 compound tubuloalveolar glands. Okay, that means the glandular part is made up of compound tubulo-alveolar glands, and the supporting part is made up of fibromuscular stroma. Okay, now the glandular part of the prostate is poorly developed at birth. After that, proliferation takes place during puberty, and again it degenerates at old age. So at various phases of life, the changes are taking place in the prostate gland. Now, if you see prostate, again it is having a capsule. Okay, here two capsules are there in case of prostate, false capsule and true capsule. So the inner one is, that is the true capsule, and outer one is the false capsule. Okay, the coverings, and in between these two capsules we are getting the prostatic venous plexus. Now the capsule is formed by the true capsule, condensation of the fibrous stroma of the gland, and the false capsule is derived from the visceral layer of the pelvic fascia. Okay, this is how the capsules are formed, and in between the capsule it is occupied by prostatic venous plexus. Very important. Now the prostate consists of 1/4 of fibrous, 1/4 of muscular, and half of the glandular tissue. This is the composition of the prostate gland. Now this is the cut section of the prostate, okay, where you can see the capsule, or you can say the coverings of the prostate. So mainly two capsules are there. As you can see, this is the true capsule, this is the false capsule. दोनों capsule के बीच में I hope you can see the prostatic venous plexus is present. ठीक है. Next, so that is about the covering. Next, if you see the interior of the prostate, I am talking about this. तो इसमें क्या रहता है? Mainly prostatic glands are there, which is compound tubulo-alveolar gland. ठीक है. Now here also three different types of glands are present, as you can see in the diagram: mucosal gland, submucosal gland, and prostatic glands proper are also called as main prostatic glands. ठीक है. These are the three different types of glands, or you can say glandular elements, which are present inside the prostate, responsible for the secretions. ठीक है. And this particular glandular tissue, which you can see over here, it is supported by fibromuscular stroma. That is the overall structure of the prostate gland. Now in the section of a prostate, you can see numerous follicles are there, okay, and those follicles are lined by pseudostratified columnar epithelium. That means if you take the section of the prostate, you can see numerous follicles are present, okay, and those follicles are lined by which cells? These are pseudostratified columnar epithelium. Next, the epithelium shows numerous folds along with the underlying connective tissue. Now during the puberty and in old age, infoldings of the follicles, they will disappear. Now the follicles, whatever they are present, so the secretion is drained. How it will be drained? It will be drained with the help of the excretory ducts, which are 12 to 20. And these excretory ducts, they are draining into the prostatic part of the urethra. Okay. And these excretory ducts, they are lined by double layer epithelium. Now what is present? Superficial layer में columnar epithelium and deep layer cuboidal epithelium are present. So already I mentioned three different types of glands, or you can say glandular tissue is divided into three different parts. First is the mucosal glands. These are small tubular glands located in the mucosa. Okay, they will directly open into the prostatic urethra. Next, submucosal glands. These are tubulo-alveolar glands situated deep to the mucosa. Okay, they will open into the prostatic urethra. And main prostatic gland, main secretions, whatever they are taking place, these are only mucus secreting glands. They are situated at the outer zone of the prostate and opens through the ducts into the prostatic urethra. Next, the rounded mass of uniform lamellated structure, which are found inside the follicles. Okay, so if you see the follicles, in some of them, okay, lamellated structures are found inside the follicles, and these are called as amyloid bodies or corpora amylacea. Okay. Now they are abundant in old individual. That means in old people it is more. Okay. Functional significance is unknown till now why they are present. Now they are rich in condensed glycoprotein, keratin, sulfate without any clinical significance. As I said, corpora amylacea, or you can say amyloid bodies, which are present inside the follicles of the prostate gland, and they are present mainly in case of old individual. Why they are present? It's still unknown, but it is present. Next, fibromuscular tissue which is there, it can also be seen in the section which contains collagen fibers and smooth muscles. These are the contents which are present in the fibromuscular tissue. Now within the fibromuscular tissue, septa are also there that separates the glandular elements. Okay. Now this septa are continuous with fibrous tissue capsule surrounds the prostate. So here also we are getting the capsule. After capsule, the supporting part I am talking about fibromuscular tissue, which is mainly made up of collagen fibers and smooth muscle. Next we are getting the septa, which will divide the gland into small glandular elements. Okay. Now, what is the function of the prostate gland? So, prostatic fluid is present mainly in the semen, 10 to 30%. Okay. So, when the semen is coming out during ejaculation, at that time, the 10 to 30% of that particular fluid is belonging from the prostate. Next, prostatic alveoli secrete prostatic fluid, contain prostatic acid phosphatase, fibrinolysin, citric acid, prostate specific antigen. Okay, so all those things are present in the secretion. Now prostatic fibrinolysin which is present, it helps in liquefaction of the semen. Now here you can see the microscopic structure of prostate. In the microscopic structure of prostate, as I said, if you take a section of the prostate, you can see numerous follicles. So here are the different follicles. See, this is one follicle, this is one follicle, this is one follicle. Okay. Now inside the follicle you can see the lining epithelium. So you can see these are the lining epithelium, this one. Okay, these are the glandular epithelium. Next, in between the follicles, we are getting the fibromuscular stroma. Here, this is the fibromuscular stroma. The fibromuscular stroma is mainly made up of smooth muscle cells, and along with that, collagen fibers are also present. Next, inside the follicles, okay, along with the secretions, we are getting this particular type of darkly stained structure. What are these? Corpora amylacea or amyloid bodies, which are present more in case of older individuals. Okay, this is also the diagram of prostate. So that is all about the male reproductive system. Next. Okay, next is the female reproductive system. Now in female reproductive system, as I said, we will be discussing about the reproductive organs, not about the external genitalia. So in case of female reproductive system, what will come first? Ovary. After that, yes, after that, fallopian tube. Then uterus. Along with the uterus, cervix will also be there. Okay. So that we have to study in case of female reproductive system. Okay. So in female reproductive system, slide of ovary is important. Okay. And it is very easy to identify also. It's not that difficult. So in case of microscopic structure of ovary, first of all, if you see the ovary, I am talking about internal structure. Mainly it is divisible into two zones. Outer part is the cortex, inner part is the medulla. Okay. Now if you see the cortex, first of all it is covered by germinal epithelium. Okay. Below the germinal epithelium, a layer is present, a layer of connective tissue that is called as tunica albuginea. Okay. What is present in the cortex and what is present in the medulla? In case of cortex, different stages of formation of oogonia are present. Okay, that means primary oocytes, secondary oocytes, Graafian follicles. Okay, then in some cases you can see the corpus albicans, okay, corpus luteum. All those things are present. So those are confined into the cortex only. Next, if you come to the medulla, it is very important because in the medulla only hilum is present through which the blood vessel has to enter the gland. So mainly blood vessels, nerves, lymphatics and hilous cells are present in the medulla of the ovary. Okay. So the ovary is covered by single layer of cuboidal cells. These are also called the germinal epithelium. Okay. Now this epithelium is continuous with the mesothelium lining of the peritoneum. Now the epithelium, germinal epithelium, that also I mentioned, doesn't mean that from germinal epithelium the cells are developed. This is only the outer covering, or you can say the lining epithelium. Now this germinal epithelium rests on a connective tissue that is called as tunica albuginea. Now here the thickness of the tunica albuginea is less as compared to the testis. Now this tunica albuginea is irregular collagenous connective tissue capsule, okay, where collagen fibers are present which are running parallel to the ovarian surface. Next, the substance of the gland, as I said, divided into two parts, that is the inner medulla and outer cortex. Now there are different changes which are taking place especially in the cortex. So if you see the cortex composed of connective tissue stroma made up of reticular fibers, numerous fusiform cells are present which resemble as mesenchymal cells, or also called as stromal or interstitial cells. Okay. Now the stroma of the cortex, okay, the stroma of the cortex is mainly made up of ovarian follicles. I hope you have studied about follicles which are present in the ovary. Okay. So if you see the ovary at birth, the cortex contains numerous primordial follicles. Okay, at birth. Now each follicle is surrounded by a primary oocyte, okay, and a single layer of follicular cells to form the somatic tissue. Next, during the childbearing age, the primordial follicles are divided into primary, secondary, and tertiary follicles. Next, during the reproductive life, the cortex contains ovarian follicles. Along with that, we are getting the corpus luteum, different stages of atretic follicles, corpora albicantia, or also called as corpus albicans. Now, can anyone tell me what is this corpus luteum and corpus albicans? Regenerate. Degenerate. Yes. Yes. Scar-like tissue. Okay. And anyone, what is atretic follicles? Atretic follicles. देखो, whenever the ovulation is taking place, we know that from Graafian follicle only the ovulation is taking place. So when the ovulation is taking place, all the mature follicle, okay, is not undergoing ovulation. Most of them is to degenerate. Approximately 90% of the mature follicles, they will degenerate. Only few will be there from which the ovulation is taking place. Okay, so those who will degenerate from the mature follicle or cannot reach the maturation, those are called as atretic follicles. Okay. Next, corpus albicans you know, and corpus this one, corpus luteum. What is corpus luteum? That also you know. And after menopause, mainly the cortex become fibrotic and it contains interstitial cells and corpus albicantia, or also called as corpus albicans. So these are present at different stages of life, especially in case of ovary. तो मेडुला में क्या रहता है? लूज कनेक्टिव टिश्यू, स्मूथ मसल्स, ब्लड वेसल्स, लिम्फेटिक्स एंड नर्व्स. ओके, along with that hilum is also present. ठीक है, hilum में remnants of the mesonephric duct and hilous cells are there, and this hilous cells main function is they secrete androgen in case of female. Okay, that is the structure of medulla. Now here you can see, first of all see this particular diagram. This is the schematic diagram of sorry, this is not uterus. Okay, my mistake, it is ovary. Please ignore this. It will be ovary. Now can you see the cortex? तो ये देखो, ये पूरा पार्ट cortex है. This is also cortex. ठीक है, ये this entire part is the cortex. This entire part is the cortex. Only this particular part is the medulla. ठीक है. Now in the cortex, first of all, what you can see, so first you can see the lining epithelium, which is called as germinal epithelium. Now this germinal epithelium is resting in a connective tissue that is called as tunica albuginea. ठीक है, as you can see, tunica albuginea, this connective tissue part is tunica albuginea. Next in the cortex, what you can see, different stages of development of oogonia can be seen. Okay, so I hope you can see the primordial follicles. ठीक है, then you can see the primary follicle. Then here you can see the secondary follicle. Then here you can see a mature follicle. Okay. Then you can see what is this? This is corpus albicans. This is also corpus albicans, and this is the corpus luteum. So these are the structures can be seen. Next, here you are getting the medulla. Here we are getting the medulla. So in medulla, what you can see? mainly blood vessels, nerves, lymphatics, smooth muscle cells, all these are present in the medulla. Okay, next is the uterus. So what is present in the uterus, anyone? Three layers are there, already you know that. Okay, endometrium is there, then myometrium is there, and perimetrium is there. So what is present in the endometrium, what is present in the myometrium, and what is present in the perimetrium, that you have to know. And always keep that in mind whenever you are writing about the uterus, you have to mention that what are the changes taking place in the endometrium, because we know that during menstrual period different changes are taking place in the endometrium. Okay, so what are the changes taking place in the endometrium, that you have to mention. Why you have to mention? Because these are significant uh, on the under the histology. Why? Because there will be changing in the thickness, there will be changing in the size of the gland, there will be changes in the blood supply. Okay, so different changes are taking place, so that's why you have to mention in the histology. So first of all, these three layers are there. Okay, so first we will see the innermost layer, that is the endometrium. So the mucous membrane is also called as endometrium. Okay, the lining epithelium is there, and lamina propria. First we are getting the lining epithelium and lamina propria. What is the lining epithelium? Simple columnar epithelium. Okay. Now at menarche, uh, before menarche, if you see the lining epithelium, उसमें cilia रहता है. Okay. But once the menstrual period starts, after that the cilia which are present, they can't regrow, because every time when there are changes, endometrial changes, the shedding of the endometrium is taking place. So again, when the regeneration is taking place, so cilia each and every time it cannot grow. That's why from ciliated it become non-ciliated columnar epithelium. Okay. Next, lamina propria stroma is also there. Now very important, इसमें क्या रहता है? Along with the blood vessels, lymphatics, nerves, we are also getting uterine glands. Okay, tubular uterine glands are there. Now these glands are again lined by simple columnar epithelium. Okay, and this particular gland, they may extend up to the myometrium. And this particular glands, the shape of the glands, size of the gland, contents of the gland changes. Okay, during menstrual period. Now in case of endometrium, two layers are there, that is the outer basal layer and inner functional layer. So if you see the functional layer, it undergoes changes during menstrual cycle, and it is cast off each month during the menstrual bleeding, or you can say it is shedding off during menstrual bleeding, the functional layer. Another layer is there, practically unaltered, means no alteration is taking place, and which is close to the myometrium, it is called as basal layer. Okay. Now this particular basal layer will help in the epithelial regeneration after menstrual period. Next, the basal layer and the functional layer is having two different types of arteries. In case of basal layer, we are getting straight basal artery, and in functional layer, we are getting spiral arteries. Next, some changes. So I hope you know about the changes which are taking place in the endometrium, mainly in the proliferative phase and in the secretory phase. Huh? Girls, anyone? What are the changes taking place in the proliferative phase? What are the changes taking place? You should know. Means endometrium during the proliferative phase, what are the changes taking place, and during the secretory phase, what are the changes taking place, that you should know. Next, what are the hormones responsible for those changes, and from where the hormones are secreted. These two things should be there whenever you are writing about the changes. Okay, so I will request everyone to go through it. I know you have studied this earlier. Okay, there is no difficult things written over here. Now, already I told you the uterine glands, okay? In case of different phases, different changes are taking place. As you can see, this is the size of the gland post-menstrual. Then in case of proliferative phase, and here you can see in the secretory phase. Okay, so first of all the size will increase, then the gland will become tortuous, and then what will happen, it will fill with secretion. What type of secretion? Glycogen and lipid. Okay, this will be filled inside the gland, especially in case of secretory phase. Why? Because it is expecting that after ovulation, if the fertilization is taking place, okay, so it has to provide nutrition. That's why it is getting ready in the secretory phase. That's why those secretions are present inside the gland. Okay, now this is a diagram showing the different types of blood vessels which are present at a different thickness of the endometrium. Okay, so this entire part is the endometrium and this is the myometrium. Okay, now in the endometrium you can see stratum compactum, the stratum spongiosum and stratum basale. Okay, these are also three different zones of the endometrium. Okay, and you can see the development of the blood vessels which are present during the proliferative phase, especially in case of endometrium. Can anyone tell me the speciality of the myometrium? Myometrium means mainly the muscles are present. Okay, in case of myometrium of the uterus, muscles are present. Now only muscles are not there. Along with the muscle, blood vessels are also present in the myometrium. Okay. Next, if you see the muscle fibers, how they are arranged. First of all, they are ill-defined, means directly you can't define them. Okay, but still three different layers are there. That is outer longitudinal, middle and inner circular. Okay, now inner one is not circular, it is reticular. Reticular means network like. Okay, reticular means network like, and this is having a very important function. Have you heard about living ligature? Living ligature, that day I have explained in the lecture hall. ठीक है, तो ये जो network like structure रहता है, through that the blood vessels which is passing. So during menstrual period what happen? The endometrium is shed off. During that time bleeding is taking place. तो further bleeding how it stop? कैसे stop होता है? तो the blood vessels has to flow through the inner layer. तो inner layer कैसे रहता है? Reticular like रहता है. तो इससे जो blood vessels जा रहा है, तो suppose blood vessel का ये वाला part it is shed off during the time of menstrual bleeding. तो whatever blood is present over here, it will come out. Next what will happen? जो myometrium है muscle layer, it will constrict. तो ऐसे constrict होने से it will give pressure to the blood vessel so that further bleeding will not take place. So that is called living ligature. Okay, and which is taking place during the time of menstrual bleeding. So three layers are there. So outer longitudinal, middle circular, and inner one is reticular, or also called as also you can say network like. Now in middle layer there is a mixture of bundles running in various direction. Okay. Now the middle layer contains vascular bed, also called as stratum vasculare. Now circular muscles of this layer form the sphincter to retain the uterine contents. So different layers, different function. Next, this particular part is very important. As you can see, the endometrial vessels which pass through the interstitials of the inner reticular arrangement, on the contraction of the muscle stops the bleeding of menstruation or during placental separation. Now inner layer act as living ligature of the uterus, which I have mentioned just now. Okay? So this particular part is important, so don't forget to mention this particular part. Next, during the time of pregnancy, there are some changes taking place in the uterus. What are those changes taking place? So the muscle cells will increase in the number, that is called as hyperplasia. Along with that, the size also increases, that is called as hypertrophy. The hyperplasia and hypertrophy both are taking place in the muscle layer of the uterus during pregnancy. Okay. Now why it is important? Because contraction of the myometrium responsible for expulsion of the fetus during parturition. Okay, that's why it is important. Okay, lastly is the perimetrium. तो perimetrium में क्या रहता है? Mainly, if you see the perimetrium, it is covered by peritoneum, covers the entire organ except the lateral borders, anterior surface and supravaginal part. Okay, these are the areas where peritoneum is absent. Remaining entire uterus is covered by peritoneum. So that is present in the perimetrium. So the parts which are not covered by peritoneum, उसमें क्या रहता है? Loose areolar tissue. Okay. Next, these are the diagrams of uterus. Okay, layers of uterus, where you can see the uterus in two different phases. Okay. So which phase is this? Follicular phase, and which phase is this? Secretory phase. Okay. So here you can see the thickness of the endometrium. See, this is the basal A, this is functional A. So see, the thickness is less. In case of secretory part phase, just see the thickness of the endometrium. This is one difference. Next difference, as you can see, the glands. See the nature of the glands, how it is present, uterine glands, and see the nature of the glands, how they are present. Okay. First of all, they will enlarge and they will become tortuous. Okay. Along with that, blood supply will also get increased. And next, here you can see the myometrium. Okay. Here you can see the myometrium. This is also the diagram of uterus, two phases. And here you can see all the layers. So you can see the endometrium, then here you can see the myometrium. Okay, and this particular part is the perimetrium. So देखो, यहाँ से यहाँ तक, this is the myometrium. Okay, so see the thickness of the myometrium, and a small part is the perimetrium, only this much. Okay, and this particular part is the endometrium, ये वाला पूरा endometrium, where you can see functionalis and basalis, or functionale or basal. Next, in case of cervix, so you have to include the cervix along with uterus. Why? Why you have to include cervix along with the uterus? Yeah, cervix is a part, common sense. It is a part of uterus, that's why you have to include this one. Okay? So don't write the cervix separately, you have to include it along with the uterus. If anyone is asking you why, because it is the part of the uterus, so we have to include it. Now there are some changes in the cervix of the uterus. Okay, some differences can be seen from the other part of the uterus. What are those differences? First of all, if you see the mucous membrane, okay, of the cervix, it is also called as endocervix. It is in the form of longitudinal folds, okay, obliquely placed folds. These are called as palmate folds. Now it contains deep branching glands that secrete mucus, and the secretion of the cervix is very important. Next, branch tubular glands are there, which are present in the lamina propria. Okay, they secrete cervical mucus, which is rich in lysozyme. Now this particular cervical mucus is important for vagina also, because in case of vagina there are no glands, mucous glands. In order to keep the vaginal mucosa moist, these particular glands are very helpful. Okay. Next, the lining epithelium of the cervix, there are some differences. What are those differences? As you can see, upper 2/3 of the cervical canal is lined by ciliated columnar epithelium, upper 2/3. Next, lower 1/3 of the epithelium is lined by non-ciliated columnar, and just near the external os, the canal is lined by stratified squamous non-keratinized epithelium. So these are the differences between the lining epithelium of the cervix. Okay, so you know that cervix is in the form of canal. जो cervix होता है, that is in the form of canal, extending from internal os to the external os. Near the, if you see the internal os or upper 2/3, it is lined by ciliated columnar. Next, it is non-ciliated columnar, and near the external os, beyond that, it is lined by stratified squamous non-keratinized epithelium. And same epithelium is continuing in case of vagina also. Okay. Next, the mucosa which is there, it is resting. Where it is resting? It is resting in the fibroelastic tissue, where smooth muscles and elastic components are there. Okay. Along with that, we are also getting dense connective tissue. Now this elastic component, why it is important? Because we know that the thickness of the cervical canal, or if you say diameter of the cervical canal, is very less. Okay? Now, due to the presence of this fibroelastic tissue, it can dilate enormously, which helps in the expulsion of the head of the fetus. Okay, that's why this fibroelastic component is very important. That means smooth muscle tissue is also there, along with that elastic tissues are also present. See, during pregnancy, the cervical mucus gland proliferate and secrete more viscous and abundant mucus. Okay, and the lumen is very narrow, but due to the presence of the fibroelastic tissue, it has the tremendous capacity for dilatation at the time of childbirth, which is enough so that the fetal head can pass through it. Okay, is also there. Now, what is this ectocervix? Now, this is the transition zone, or you can say transformation zone, where simple columnar epithelium of the cervical canal becomes stratified squamous non-keratinized epithelium and continuous with the vagina. So, when I have explained about the cervix, when I have explained about the cervix, that time I have told you that the cervix used to protrude into the vagina. Okay, if you remember, and the part which is adjacent to the cervix, that is called as fornices of the vagina. Okay, now in that particular part, it is called as ectocervix. Now in ectocervix, the transformation is taking place. That means here the lining epithelium will be stratified squamous non-keratinized. Okay. Now if you see the particular diagram, I know it is a bit difficult to understand the diagram. Okay. So see, we'll start from here. We'll start from here and then we'll go to this part. So mainly in the cervix, we are getting three different layers. First, we are getting the endocervix. Okay, this is the endocervix. Okay. Now in the endocervix, first will be the lining epithelium. Beyond the lining epithelium, the lamina propria, which is there, where we will be getting the different cervical glands. As you can see, the cervical glands are present. These are mainly mucus secreting glands. Okay, which is rich in lysozyme. Next, this entire part is made up of stroma. तो इसमें क्या रहता है? Fibroelastic components are there, and along with that, connective tissue is also present. Okay, dense connective tissue in this particular part. And the last part, if you see over here, this is the ectocervix. तो ectocervix में क्या होता है? The lining epithelium का difference होता है. That is stratified squamous non-keratinized epithelium is present, and which is continuing in the vagina, which will be continued in the vagina. Okay. Forget this particular part. These are the Nabothian cyst. Okay. If you, I know you will not remember this, but I can remember. I have explained this. Do you remember the Nabothian cyst? No, I know you don't remember, but I have explained in the applied anatomy of uterus. ठीक है, ये जो particular gland है, gland का जो secretion होता है, if those glandular part जो secretion होता है, if it get blocked, at that time the cyst which is formed, these are called as Nabothian cyst. Okay, and it is very commonly occurring cyst. ठीक है, very commonly occurring cyst. This part will exclude. This is not that important. Okay, this part will exclude. Okay. Last is the fallopian tube. So in female reproductive system, first what we have studied, ovary. After that what we have studied, uterus. ठीक है, इसके along with the uterus we have studied about the cervix also. ठीक है, what is the last? Fallopian tube. ठीक है. So it is a mucomuscular tube. Three layers are there. Lining epithelium is ciliated columnar epithelium. Okay. Now here two different types of cells are present. Okay. What are these two different types of cells? First of all, ciliated columnar epithelium, along with that non-ciliated secretory cells are present, and these are called as PEG cells. Okay. So this particular PEG cells, इससे जो secretions होता है, those secretion provide nutrition to the ovum. It secretes nutrition to the sperm when it is traveling through the fallopian tube. ठीक है. Next, muscle coat, only two layers, inner circular, outer longitudinal. ठीक है. The contraction helps in transportation of the content which is present inside the tube. And lastly, the serosa, which is purely made up of mesothelium. Okay. Next, here also the mucosa shows numerous longitudinal folds which will fill the lumen. Same like the ureter which we have studied earlier. Now here you can see the diagram. Now in the diagram, so what is this? ये part क्या है? Can anyone tell me what is this? This is the lumen of the fallopian tube. Okay, ये जो particular part है, this is the lumen of the fallopian tube. Now can you see the mucosal folds? So this mucosal fold almost it will occupy the lumen. ठीक है? Now take one particular fold, then you can see this is the lining epithelium. This is the lining epithelium. Okay. Next, this is the lamina propria. Okay, this is the lamina propria. This is the lumen. This empty space. This is the lumen. Next, these are the muscle layer. Now in muscle layer, you can see inner circular and outer longitudinal. Okay, and followed by the serosa. ये जो लाइनिंग इपिथेलियम है इसमें दो टाइप का सेल्स रहता है. टू टाइप्स ऑफ सेल्स आर देयर. फर्स्ट ऑफ ऑल ciliated columnar epithelium and non-ciliated cell. Non-ciliated cells are also called as PEG cell. Okay, it is non-ciliated but it is secretory. इसका जो secretion होता है that provides nutrition to the sperm, provides nutrition to the ovum when it is passing through the tube. Okay, so that is all about the fallopian tube.